Family-centered maternal nursing. Each family is unique and it has its own set of challenges and advantages. For example, we look at the immediate family. There may be one or two parents in the home. The extended family may cross generations, and the individual needs are going to be more or less important than the needs of the group. The children are considered an economic asset. Grandparents often assist in raising grandchildren, and there's a respect for the older generation. In a single parent family, the number has increased in this family type due to divorce rates, children who are born out of wedlock, and changes in adoption laws. Women are most often the head of these families. The communal family is a group of various couples and children. They may be single friends, older adults, but these family members share responsibility for all duties of homemaking, childbearing, etc., or child rearing. Same-sex marriage families. Children are often part of these families through previous relationships, fostering, adoption, artificial insemination, or surrogacy. Then we have the step family and the blended family. The step family involves a custodial parent with a new spouse and children. The blended family will involve two partners who both bring children into a marriage. And they may also have children in that new relationship. Cohabitation families, couples live together but they're not married. And the adoptive family. Different factors that influence childbearing are family sizes. With the smaller families, more attention is going to be devoted to each child, and children can relate well to the adults in these families and have advanced language and intellectual development. In the larger family, there's greater interdependence between the children and less dependence on the parents. The sibling order and gender. Parents are often more anxious and uptight with that first child. Parental behavior. It's a trend for families to spend less time together. I mean, parents are working all the time, right? And it affects a family's communication and interpersonal relationships. Divorce. Children's relationships will depend on the ages and the kind of care and relationships prior to the divorce. And culture influences timing and the number of children, health beliefs, and practices. Cultural competency is the integration of the elements and cultures into nursing care. So it's really important to do a self-assessment to understand cultural influences and be sensitive to your client's culture. It enhances cooperation from the client and the family and helps minimize frustration. So question, true or false? The nurse should inquire about cultural beliefs during the assessment to ensure each client has the same belief system as the nurse. Well, this is false. Okay, different settings for the maternity client. Prenatal, postpartum home health care can be done where the majority of that prenatal care occurs at a clinic or a healthcare provider's office. However, positive outcomes do occur with home visits from nurses, and this includes increased maternal-infant interactions, improved paternal impact, and decreases preterm births and substance abuse. With a case manager, they can assist in delivery of high-quality care with pregnancy complications being lower cost. Settings for the birth are going to be dependent on cultural beliefs, personal preferences, and an increase in delivery options. Many people choose to deliver at home with a midwife or a certified nurse midwife under the supervision of a physician. Usually, if they choose a midwife, they're going to see the physician once or twice, so the physician is at least familiar with the client and their history. The mother or family will provide newborn care in these instances. There's also birth centers, and these are allowed with low-risk births. They rarely require medical interventions, and physicians are rarely present. So RNs, LPNs, the certified nurse midwives, and doulas are often in attendance during these births. Medical equipment is available if necessary. It is associated with increased maternal satisfaction, fewer medical interventions, and a decreased cost. And hospitals, of course. Hospital deliveries have progressed to a more family-centered birth, which does allow more time with the infant. We see couplet care or rooming in, which allows the infants to remain in the room with the family unless there's a medical issue. So, question. Which skill used by the nurse is a process which involves speaking or acting on behalf of the client? And that is client advocacy. And now on to the post-test.